I'm sure you've heard the news. An Israeli raid has targeted the last functioning hospital in northern Gaza, sparking international outrage. The World Health Organization strongly condemns an Israeli raid on Kamal Adwan Hospital in Beit Lahia, northern Gaza. This attack has not only drawn the ire of global health bodies, but also human rights organizations worldwide. This was the last major hospital still operational in the area, providing essential medical services to thousands of people. The raid has put approximately 75,000 Palestinians at severe risk, exacerbating an already dire humanitarian crisis. Significant damage has been reported to critical departments like the laboratory, which was essential for diagnostic services, the surgical unit, which handled emergency and routine surgeries, the operating room, and medical storage, which housed vital supplies. While many detained medical personnel have been released, their ability to continue providing care is severely compromised. The hospital director's whereabouts remain unknown, adding to the chaos and uncertainty. The Israeli Defense Forces claim the hospital was a Hamas terrorist stronghold, a statement that has been met with skepticism and calls for independent investigations. They state that patient relocations were carried out for safety reasons, but the abrupt nature of the evacuations has raised serious concerns. Over 240 individuals, including the hospital director, have been apprehended on suspicion of terrorist activities, a move that has been widely criticized. The detained individuals are reportedly being held without clear evidence, leading to international calls for their immediate release. The WHO reports that stable patients and staff were moved to an unspecified location, raising concerns about their safety and well-being. Some were transferred to the Indonesian hospital, which itself had suffered damage from previous bombings, further straining its limited resources. This hospital lacks the necessary resources to provide adequate care, with shortages of medical supplies and staff. Concerns are rising for 15 critical patients, 50 caregivers, and 20 health workers transferred to the Indonesian hospital, where conditions are far from ideal. The medical staff are working under extremely challenging conditions, struggling to provide care with limited resources. The WHO is also deeply worried about the hospital director, who remains uncontactable, adding to the growing list of missing persons in the region. Residents report that the Indonesian hospital lacks essential utilities like water and electricity, making it nearly impossible to maintain sanitary conditions. Disturbing accounts have emerged of individuals being forced to walk towards southern Gaza, a journey fraught with danger and uncertainty. Some medics have alleged they were subjected to beatings and humiliation by Israeli forces, further complicating the humanitarian situation. Stay tuned for more updates as this situation unfolds. The international community is closely monitoring the developments, and pressure is mounting for a resolution to this escalating crisis.